To show the importance of the work environment, we will give the breakdown of the 2 case studies shown in Module 1. We begin with the chef's story. So how did the chefs manage to learn in the work environment? They are allowed to work in teams and have their own responsibilities, discretionary power, and supportive supervisors to depend on. The supervisor simultaneously does his work while monitoring the trainee in the kitchen. Also, the mission and vision of the workplace translate into the tasks given to the trainees. The supervisor gives the trainees challenges, uses demonstrations, and provides them with opportunities for practice. And because the trainees feel trusted enough within the workplace, they ask questions, are more observant, take notes, learn through trial and error, and practice more. While they may occasionally make mistakes, they are allowed to learn from them. However, why did they learn as they did? At the individual level, the trainees have a goal they want to achieve, which is to get a qualification. They desire to be a chef and feel trusted at the workplace, and also have a sense of confidence in what they do. They too contribute to the work, for example, through giving ideas for the menu. At the workplace, mistakes are accepted as a rich source of learning. They know what is expected of them, and they learn from structured sharing about the whole food production process and how it impacts the guests at the end. The trainees have a chance to use different types of knowledge, for example, theoretical knowledge, practical knowledge, and knowledge about the guests. They are not limited to small assignments. Instead, they get more responsibilities which build up their skills through everyday work activities. Trainees also do not stay at one kitchen for too long. They are rotated every few months, making the learning more structured. Moving on to the nursing aides. They started with high expectations in the first week, and then it became increasingly negative. Observations, demonstrations, as well as buddying for the first week were strongly emphasized, but afterwards, they fizzled out. As the hospital's hierarchy is very strong, there is no flexibility for the lower ranks to make any decisions or give any opinion. The nursing aides often work alone, limiting discussions amongst colleagues and teamwork opportunities. There are also very strict standard procedures to follow, and the work is time-driven. The rules of the hospital have to be followed religiously. Information is only shared when asked, and because of the limited sharing, there is limited feedback. Thus, no trust is developed between the nursing aides and their superiors. Not to mention, the nursing aides have very little decision-making power, which results in limited responsibility as well. So what contributed to their negative learning experience? The nursing aides couldn't see a future for themselves at the hospital. Their work is looked down upon as compared to others in the organization. Their voices and opinions were ignored, resulting in them feeling like they do not matter. There is no trust between the patients and themselves. As a result, their confidence level drops, and so does their work performance. To make things worse, in the industry, there is a high reliance on foreign labor from different countries, which makes effective communication difficult. The job requires medical knowledge, but the nursing aides were not trained for it. A strong hierarchy is present, and there is limited access to learning, as there is a lack of interaction, and structured learning opportunities were catered more for the senior workers. The next video will further elaborate on the factors that affect the learning environment, as well as the learning conditions at the workplace.